Welcome to This Week in Allergy and Immunology. This week, we're covering 10 notable papers spanning advances in therapeutics for inflammatory diseases, a re-examination of disease definitions and goals in asthma and urticaria, and new findings in food allergy and primary immunodeficiency. Let's dive in. Advances in therapeutics. We begin with a major clinical trial from the New England Journal of Medicine. Investigators tested brepocitinib, a first-in-class oral inhibitor of TYK2 and JAK1, for the treatment of dermatomyositis. In this Phase 3 trial, 241 adults with dermatomyositis resistant to previous therapy were randomized to receive 30 milligrams of brepocitinib, 15 milligrams of brepocitinib, or placebo daily for 52 weeks, all while continuing standard therapies. The primary endpoint was the total improvement score at week 52, a composite measure where higher scores indicate greater improvement. Results. The 30 milligram dose of brepocitinib proved superior to placebo, with a mean total improvement score of 46.5 versus 31.2, a statistically significant difference of about 15 points. The lower 15 milligram dose, however, did not show a significant benefit over placebo. Importantly, the 30 milligram dose also hit all 9 key secondary endpoints, demonstrating significant improvements in skin disease, allowing for glucocorticoid tapering, and enhancing physical function, with benefits seen as early as week 4. On the safety side, serious infections were more common in the 30 milligram group, occurring in 10% of patients compared to just 1% in the placebo group. This trial establishes the 30 milligrams dose of brepocitinib as a new, effective oral option for patients with refractory dermatomyositis, though vigilance for infection is warranted. This trial fits into a rapidly expanding therapeutic landscape. A review in the Annals of Allergy, Asthma, and Immunology reflects on the era of monoclonal antibodies, which began in 2003. The authors trace the evolution from partially humanized antibodies to fully humanized versions, the rise of biosimilars, and innovations like Fc portion mutations that extend a drug's half-life. The article looks ahead to next-generation approaches, including bispecific and trispecific antibodies, nanobodies, and antibody-drug conjugates targeting key players like IgE and mast cells. However, the review underscores a persistent challenge: the need for better biomarkers to match the right patient to the right therapy. Beyond established pathways, basic science is uncovering novel therapeutic targets. A study in the Journal of Allergy and Clinical Immunology explored the CXCL16-CXCR6 chemokine axis in asthma. Using single-cell RNA sequencing, researchers found that the receptor CXCR6 was elevated on lung CD4 T cells in both human and mouse models of asthma. In mice, short-term blockade of the ligand, CXCL16, during allergen challenge reduced the accumulation of lung CD4 memory effector T cells by 50 to 70% and decreased tissue inflammation. This effect was durable, suggesting that targeting this pathway could regulate the accumulation and persistence of pathogenic memory T cells in the lungs, offering a potential new strategy for asthma treatment. In a similar vein, a paper in Science Translational Medicine identifies a new target for pulmonary fibrosis. The study proposes that senescent or aged fibroblasts drive fibrosis because they evade clearance by the immune system. Researchers found that these senescent fibroblasts express HLA-E, the ligand for the inhibitory checkpoint receptor NKG2A found on natural killer or NK cells. This interaction effectively creates an immune-privileged niche for the fibroblasts. In a mouse model, blocking NKG2A restored NK cell function, leading to the clearance of senescent fibroblasts and resolution of fibrosis. Further, the clinical-grade NKG2A inhibitor, monalizumab, reactivated NK cells from patients with idiopathic pulmonary fibrosis and enhanced the killing of senescent human fibroblasts in vitro. This work uncovers a key immune evasion mechanism and suggests that targeting the HLA-E-NKG2A axis could be a promising strategy to reverse pulmonary fibrosis. Redefining disease states and goals. Our next theme focuses on how we conceptualize and manage chronic allergic diseases. A review in Allergy asks if remission is now an achievable goal in asthma. The authors define remission as a high level of disease control, including no symptoms or exacerbations, no need for oral corticosteroids, and stable lung function with or without ongoing treatment. While spontaneous remission is associated with factors like younger age at onset and milder disease, the paper highlights that modern biologic therapies have shown considerable success in achieving remission, shifting the therapeutic paradigm from mere control to a more ambitious goal. Meanwhile, a perspective piece in the Journal of Allergy and Clinical Immunology challenges the current understanding of chronic spontaneous urticaria, or CSU, endotypes. The prevailing model divides CSU into type E, driven by IgE autoantibodies, and type IIB, driven by IgG antibodies to the IgE receptor. The author argues that the evidence for a type Ia endotype is sparse and conflicting, making it difficult to separate from background atopy, which is common in the general population. In contrast, the data for a type IIB mechanism are described as substantial and reproduced by multiple labs. However, even this better established mechanism is demonstrable in less than half of patients with CSU. This paper serves as a critical reminder to question accepted disease models and highlights that the underlying cause for many CSU patients remains unknown. Rounding out this theme is a comprehensive review on eosinophilic esophagitis, or EoE, also from the Journal of Allergy and Clinical Immunology. The paper summarizes recent advances, noting that EoE pathogenesis involves impaired epithelial barrier function and type 2 inflammation. A key insight is that simply depleting eosinophils and mast cells does not always improve patient symptoms, pointing to other mechanisms of epithelial dysfunction. The review covers the evolving therapeutic landscape, which includes dietary elimination, topical corticosteroids, proton pump inhibitors, and anti-type 2 biologics, providing a useful update on this complex disease and its relatives, the eosinophilic gastrointestinal diseases. Food allergy and primary immunodeficiency. Our final section covers new findings in food allergy and the genetic basis of immunity. A highly practical study from Allergology International provides important data for clinicians performing oral food challenges, or OFCs. In a 10-year retrospective study from a Japanese center, researchers compared the eliciting dose, the amount of food needed to trigger a reaction, in children who regularly consumed small tolerated amounts of an allergen at home versus those who practiced strict avoidance. After propensity score matching for egg, milk, peanut, and walnut allergies, the results were consistent. For all 4 foods, the group with regular home intake had a significantly higher eliciting dose. For egg white, the median eliciting dose was 54.7 milligrams of protein in the intake group, compared to just 12.7 milligrams in the avoidance group. For milk, the doses were 10.6 versus 3.3 milligrams. These findings provide quantitative evidence that regular intake of an allergen below the observed adverse effect level can increase a patient's reaction threshold, a finding that could help refine OFC protocols. Finally, we turn to the fundamental genetics of our field, with 2 papers from the Journal of Allergy and Clinical Immunology. First, a review summarizes key concepts and emerging needs in the study of inborn errors of immunity. The authors highlight the ongoing need for new gene discoveries, improved phenotyping of both new and established diseases, and an embrace of new disease mechanisms like somatic mosaicism. They also point to the growing challenge of interpreting variants of uncertain significance and the vital need for better biomarkers and functional assays. Providing a powerful example of these principles in action, a second paper identifies a new cause of combined immunodeficiency. Through exome sequencing, researchers discovered a homozygous loss-of-function mutation in the gene SIT1 in a patient with combined immunodeficiency and recurrent lymphoma. SIT1 is a transmembrane adapter protein, known to be a negative regulator of T-cell receptor signaling. Functional studies on the patient's T cells showed skewed T-cell subsets, increased activation and proliferation, but paradoxically, impaired CD8 cytotoxicity and immune synapse maturation. This work establishes SIT1 deficiency as a novel cause of combined immunodeficiency that predisposes to lymphoid malignancy, illustrating the direct line from gene discovery to a new diagnosis. Editor's pick. If you only have time for one paper this week, make it the Phase 3 trial of brepocitinib in dermatomyositis. This study provides high-quality evidence for a new, effective oral therapy in a difficult-to-treat systemic inflammatory disease commonly managed by our specialty. The clear, dose-dependent efficacy and detailed secondary outcomes make it immediately relevant to clinical practice. Clinical bottom line. Here are the key takeaways from this week in allergy and immunology. First, for adults with treatment-resistant dermatomyositis, the oral TYK2/JAK1 inhibitor brepocitinib at a 30 mg daily dose significantly improved a composite myositis index, skin disease, and function, but carries an increased risk of serious infections. Second, in food-allergic children, regular home consumption of an allergen at a tolerated subthreshold dose is associated with a significantly higher eliciting dose during an oral food challenge. This supports the practice of continued low-dose exposure to build tolerance. Third, basic science continues to yield promising therapeutic targets. Blocking the CXCL16 pathway may reduce pathogenic T-cell memory in asthma, while blocking the NKG2A checkpoint on NK cells may reverse pulmonary fibrosis by clearing senescent fibroblasts. Fourth, the concept of remission is an emerging and achievable goal in asthma management propelled by the success of biologic therapies. Finally, the evidence for an IgE autoantibody-driven type Ia endotype in chronic spontaneous urticaria is being questioned, reminding clinicians that the cause for a majority of CSU patients may not fit neatly into current paradigms. That's your roundup for this week in allergy and immunology. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary. For clinical decisions, always consult primary sources and current guidelines. See you next week. This is an automated summary generated by artificial intelligence, which can make mistakes. Always review the original source materials.